Hello everyone. In this video we will continue about the rest of the instrument. So this is a Wrigley's outlet obstetric forceps. So there are three variety of forceps. That is first one is the long curve forceps with or without axis traction device. That is variety is the Das variety. Second one is the short curve forceps. That is Wrigley's forceps. And third one is the Killian forceps. So there are in this forceps there are two blade, that is left blade and the right blade. So in this left and right is used relation to the maternal pelvis. So usually each blade has a four part. First one is the blade, that is fenestrated to facilitate good grip on the fetal head, and this blade has a two curve, that is a pelvic curve, that is the curve of Caras. So the front of forceps is the concave side of the pelvis. So you can see this is pelvis curve, and that is in front side of the concave side. Then second curve is the cephalic curve. So curve on the flat surface is known as the cephalic curve, and this the second part of this blade is the shank. Shank is usually the part between the blade and the lock. So this is shank. Then third part is the lock. Then this is, in this there is English lock, that is the type of fixed lock. So in this usually in this system there is a socket which is located on the shank and junction of with a junction of with handle. So another type of lock is the sliding lock, that is usually present in the Killian forceps. In this in this type of lock, usually blood can move forward and the backward independently. And fourth part of this is the handle. So question is that how to identify blade. So when the isolated blade is present, then first is the tip should be pointed upward in this way, and cephalic curve is to be directed inward and pelvic curve forward. So here you can see this is left blade, and when articulated both three criteria I have to kept in mind, and same as above. So blade which correspond to left of the maternal pelvis is the left blade, and which correspond to the right side is the right blade. So ACOG criteria for outlet forceps are: first, if scalp is visible at the introitus without separating the labia. Second, fetal skull has reached to the pelvic floor. Third, when the sagittal suture is should be in anterior posterior diameter of the pelvis, and usually rotation doesn't exceed 45 degree. So what are the indication of forceps? So in this maternal indication and fetal indication and other indication. So maternal indication are that when there is inadequate expulsive efforts are there and maternal exhaustion is there, and then we have to avoid maternal expulsive effort like cardiac disease. And in fetal indications are when there is non-reassuring fetal heart rate pattern, means fetal heart distress is there, and just like post-maturity and after coming head of a breech. While we have to apply forceps also in case of when there is a prolonged second stage of labor. So second stage usually is nullipara greater than 2 hours, and multipara it is considered at greater than 1 hour. And we have to cut short the second stage of labor like preeclampsia, cardiac disease, and post-cesarean pregnancy. So before application of the obstetric forceps, we should check that bladder should be empty, and we have to do pervaginal examination. In this we have to see that cervix is fully dilated, membrane should be ruptured, and there should be a favorable head position, and there is no contraction of the outlet. So episiotomy should be given. First of all, we should be given episiotomy, and local infiltration has to be given. Then identify the left and right blade. Then locking, and we should apply usually left blade is first. Left blade we have to insert first. So how in this usually left blade is held with the left hand, and the four fingers of the semi-supinated right hand are inserted along the left lateral vaginal wall, and the left blade is held by the index middle thumb in pen holding manner, like held vertically parallel to the right inguinal ligament. Then blade is introduced along the right hand, and blade is pushed up, and the handle is carried downward and backward, traversing a wide arc of circle until the shank is to lie straight on the perineum. And the same manner we have to apply right blade. Then locking of blade has to be done. When usually we apply blade correctly, then blade should be articulated with in easy manner. Then third step is the traction and removal of, and fourth is the removal. So for giving the traction, we usually traction is given by the gripping the handle, placing the middle finger in between the shank and the right and index finger either side of the finger guard. So direction of pull is usually correspond to the axis of birth canal. So usually pull is downward. Direction of pull is the downward and backward until the head come to the perineum. Then the direction of pull is horizontal, straight toward the operator, and then direction of pull gradually change to upward and forward towards the mother abdomen to deliver the head by extension. Then blades are removed one after the another, and in this we have to remove right blade first. Then another variety of the forceps, that is the Killian forceps. This is known as the rotational forceps. In this there is anterior blade and the posterior blade, and usually it is used when there unrotated head or face presentation, and it usually correct the asyncliting the head. Means it facilitates grasping and correction of asynclitic head because of it sliding down. So in this usually we applied anterior superior blade first, and the blade is inserted along the side wall of the pelvis, and then it is wounded by swinging it around the fetal face to its anterior position. So usually this usually correct the asynclitism. Then students are supposed to be know about the complication of the forceps. What will be the maternal complication and fetal complication? What is the prophylactic forceps? What is the trial forceps? And what is the failed forceps? So details are given in books. So next coming to the second instrument, that is bar Parker handle. So this instrument is made up of flat instrument that is made up of a stainless steel, and it has a slot that is for attaching a scalpel blade. So surgical blade are usually disposable, and usually they have 10 to 20 in number, and various sizes are available, and they have this instrument has a shaft, and it has many serration to prevent slipping and for better gripping. Usually these handles come in 3, 4 and 5 number, and usually we use 4 number blade. So there are two type of gripping method to hold this. So first one is the pencil grip method. In this method is used when we have to give fine incision. So in this method usually blade is angled to 30 to 40 degree to the incision surface, while second one is the dinner knife grip. So this grip is used when we want to give a deep incision. Then next instrument is the needle holder. So this can be straight, that is Wengston, and curved, that is Hennig needle holder. So at their distal hand they have ring finger grips and a ratchet lock. So it is used for the placing suture with help of needle. In this needle holder, needle is loaded at 45 degree and it is close to the tip of needle holder. So here you can see there is a groove that differentiate needle holder from other long instruments like RT forceps. Then coming on tooth forceps, that is Addison forceps, and it is used to hold the skin by suturing or stapling, and they are used to hold firm tissue like fascia or rectus sheath like structure. While the smooth non-tooth forceps is also there, that is known as the D. Baker forceps, and it is used for holding delicate and friable tissue like peritoneum muscle. And they are also used in vascular surgery and retroperitoneal lymph dissection. Then next instrument is the Mayo scissor. Mayo scissor has a rounded tip, and they can be straight or curved. So this is curved. They are used for dividing the tough tissue like rectus sheath. And another one is scissor is the Madgen-Baum scissor. This scissor have a short blade proportionate to shaft. So they are used for cutting delicate tissue structure like peritoneum, and also used for the retroperitoneal dissection. Then moving on next instrument, that is the Babcock forceps. It is a non-traumatic instrument which has fenestrated triangular blade, and it has a groove jaw. Indication of its uses are to hold the tubular structure like fallopian tube in various type of the tubal ligation surgery. So students are supposed to be know various method of the ligation. Secondary use of this tube is the tuboplasty, that is the recanalization to hold the tube, and it is also used to hold the ovary during ovarian cystectomy, and it also hold the ureter during the Vardhan surgery to dissect it, and it can also hold the bladder wall during the repair of the bladder. Then come to hemostatic artery forceps, that is straight, may be curved, and in this instrument there is horizontal serration. Here you can see these are horizontal serration, and one lock is there, and it is used to catch bleeding point, and also it is used to open facial plane in blunt dissection, and we can also hold the suture by use of this instrument, and hold fascia aponeurosis like tough structure by this. Then move of abdominal wall detector. So first one is the Doyen detector. So in this there handle, and there is a curved retraction blade, and it is usually used for the retraction of abdominal wall suprapubically after opening of the peritoneum. So when UV fold of peritoneum is opened, then it is used to retract the bladder during C-section and hysterectomy. So this broad retracting surface achieve good retraction. So what are the indication? So it is used in during procedure like cesarean section, laparotomy, abdominal hysterectomy, etc. So another one instrument is the Devers retractor. So Devers retractor. So this is Devers retractor. This instrument has various in length and width to make it useful, and usually it is used in usually gynecological procedure. And since the bladed are thin, so it occupies little space, and thus it is an ideal instrument while we operate in depth. So both of these retractors are non-self-retaining. We use assistant to hold these type of retractor. So we should know about the self-retaining retractor name, at least name. So name of self-retaining retractor is the Balfour retractor. Then we come to Ellis forceps. Usually Ellis forceps are this instrument is traumatic, and it is not used for the skin. And this handle of this instrument also a ratchet look. Here you can see this is a peculiar type of teeth in its front part. So students usually sometimes confuse between the Ellis forceps and the valsellum. So here you can see this is a usually short instrument, and in this there is multiple tooth and opposing each other, and this is a straight handle. While in the tenaculum and valsellum there is curved, so you can differentiate between these tools. So Alice forceps is used to hold the angle and cut edges of the uterine segment during the lower segment cesarean section. Second use is to hold the rectus sheath during dissecting it from the rectus muscle. While in gynec use, it is used to hold the cut edges of vagina during anterior colporrhaphy and the posterior colporrhaphy, in which we usually dissect the vaginal mucosal flap underlying bladder or rectum, and it is also used to hold the cervix when abdominal hysterectomy has to be done, when we draw the cervix after opening the vault of vagina. Then we come to Thiel's valsellum. Thiel's valsellum. It is basically used in gynec procedure, but usually we have to used to hold the antelip of the cervix. So always hold this instrument in this way so that the concavity face upward. Never hold this instrument in this way. So usually this curve corresponds to the axis of the vagina, and usually advantage of this curve is that it usually not upset the field of a surgeon. So it has a jaw that is 3 to 4 tooth, and one is box type of joint, and we usually use this instrument to hold the anterior lip of cervix in dilation and curettage, and any suction evacuation, any endometrial biopsy, cervical biopsy. We have to do insertion of copper T in or stabilization of cervix during hysteroscopy or hysterosalpingography. So on all these procedures, we have to hold the anterior lip of cervix, and by this instrument we usually hold the anterior lip of the cervix. So so question is that in which condition posterior lip of cervix is to be held? So answer is when we have to do procedure any procedure on the pouch of Douglas, that is coldocentesis, and any colportomy. So these are the instruments that are used in the obstetrics. First one is the obstetric forceps, that is Bard Parker knife handle. This is needle holder. This is tooth forceps. This is non-tooth forceps. That is neo scissors. That is artery forceps. This is Babcock forceps. This is Thiel's valsellum, and this is straight artery forceps, and another is the Doyne's retractor, and this one is the Devar's retractor. So in this video we try to include the most of the instruments that are used in the obstetric. In next video we will discuss about the gynec instrument. Thank you for watching for this video.